Welcome back, dear viewers. We've been joined here in the series of Hala Kuwait with our special guest, Mohammad Darweesh, psychologist. Of course, it's a pleasure to have you here in the series of Hala Kuwait.
Thank you so much. I really appreciate that.
Thank you. Of course, we'd like to know more about depersonalization and derealization because from what I read, they're kind of different but similar in a way.
Yeah, kind of. So depersonalization-derealization disorder is a dissociative disorder, and it occurs when you have the feeling that you are like observing yourself outside from your body, or you have a sense that things around you aren't real.
So this is derealization.
So this is
depersonalization.
It has both symptoms, so the majority of patients suffer from both symptoms. That's why it's either called like a depersonalization or derealization.
Of course. And what are the symptoms when it comes to these kind of...
Well, you are disconnected from your thoughts, feelings, and body. And you are disconnected from your environment. Also, you feel like you are a robot, like you're not in control of your speeches or your movements. So those are the three main symptoms.
Of course, and I think for a lot of people, usually they are wondering, maybe is this something that happens throughout the age, or is there like a specific age when this occurs?
The majority with people about the age, the majority of them have the disorder and they figured it out after they passed like their 30s or 20s, you know. In this phase of age, they will find that they have these symptoms and they are having them repeatedly over and over, and they will realize that this is a DDD, depersonalization or derealization.
Okay, so
disorder.
We don't have these kind of cases with the kids or with the older adults?
You can have them, but in like low number, you know what I mean? But the majority of cases, they discover them actually later, because like dissociative disorders usually impact a low number of the population. For example, the percentage of DDD is 2% over a population, you know. So
yes.
It's a rare dissociative disorder.
And when it comes to the causes or the risk factors, can you tell us more about them, please?
Well, there is no certain cause, like the cause is not well understood, but there are many risk factors that could place you at a higher risk factors to develop this disorder. First, I would say a nervous system that's less reactive to emotions. Second, I would say physical conditions such as seizure disorders.
And how do we react when we have like a person or a member of the family usually with these kind of issues? How do we react when they have seizure? Do we call the police? Do we call someone? Or is there something that we can do in order to help them?
It's not a correlation, it's not a causation, the seizure. Some people with seizure do not develop this disorder, but it places you at a higher risk for having the disorder.
Yes.
You know what I mean? So seizure could be a risk factor for having this disorder or the development of that disorder, you know?
Of course. And what about the daily complications?
So episodes can be really frightening and disabling, and they could cause like difficulty in focusing and remembering things, and they could cause distortions in the vision and the shape of objects and other stuff.
And can you actually have depersonalization and derealization at the same times, or is it like something completely different that happens to every person?
Definitely, yeah. The majority of patients experience both symptoms. What I mean is they experience derealization symptoms and then they experience the depersonalization symptoms.
And what is the difference between them?
Okay, so let's start with depersonalization. When it comes to depersonalization, symptoms include the feeling of you are the observer of your thoughts, feelings, and body. And you are like a robot, like you are not in control of your actions. When it comes to derealization, you have a distortions in the distance and shape and the shape and size of objects.
Does it happen even for like parts of your body? Do you see your parts of your body sometimes like something that's strong?
Exactly, yeah,
bigger?
That happens with a lot of patients actually. They feel like they have the feeling, they are not actually watching it, you know. They know it's a feeling. It's not a psychotic disorder, it's a dissociative disorder. They just have the feeling that they are watching even parts of their body, you know, like shrunk legs, you know.
And do they like get used to it, or is it something like every time they feel like panicked or attacked, whenever they feel like they see these kind of images or these thoughts, because as you mentioned, they feel like they're a robot, they're not in control?
Yeah, they suffered actually, like they can't get used to it because like it's a disorder. It will be with their daily life. Here's the complications of it, you know. They will be
Yes.
like, okay, am I in real environment? Is that my real surroundings, you know?
And of course, and when it comes to these kind of episodes, as you mentioned, because they can struggle with work or even at school sometimes, how long are these episodes? Is it like a small period of time?
Well, so the episodes like depersonalization-derealization episodes can last for days, hours, weeks, months at a time, you know.
Yes.
But the patient can get periodically better or worse.
So is it treatable?
Yeah, it is.
So how can we treat the patients when it comes to depersonalization or any kind of issues when it comes to
Okay, so
derealization?
with dissociative disorders, usually the main therapy is psychotherapy, where it's a talk therapy. And then your health provider will opt for you the type of therapy that is suitable for you. And the most opted one is dialectical behavior therapy, which they will work on reducing the intensity of your emotions that are linked to your depersonalization symptoms or derealization symptoms.
So emotions have a huge role when it comes to treating these
Exactly,
kind of
those are
patients.
hormones, you know, they could impact you a lot.
Of course. And of course, Mohammed, it's a pleasure to have you here in the series of Hala Kuwait.
Thank you
you
so
so
much.
much. Thank you. Dear viewers, we had with us Mohammad Darweesh, psychologist. Let's move on to our next report. It's about the Ministry of Interior, so stay tuned.